Hello, I'm John Foster, and I'm a medical doctor who does Social Security disability exams. And today I'm going to talk about body dysmorphic disorder. As usual, everything I say reflects my own opinions based on my own study and experience, and not the opinions of the Social Security Administration or any other medical body. Now, you may be wondering, body dysmorphic disorder and disability? Well, I wasn't prepared for the cornucopia of psychopathology I'd see when I began doing disability exams in 2017. But I was prompted to do this because I had a patient who clearly had body dysmorphic disorder recently, and that was the major basis for their disability claim. So what is body dysmorphic disorder? It's an obsessive belief that some body part is severely flawed and warrants exceptional measures to correct or hide it, when in reality the body part is either normal or minimally flawed. The patient's thoughts about this flaw are pervasive and intrusive and may occupy many hours of every day. The patient I saw was a middle-aged person who'd fractured their jaw a bit over a year prior to my encounter. Their jaw had required surgical repair. The patient was convinced that the surgeon had operated poorly and that their jaw was dislocated on one side, their teeth were not aligned, and the appearance was horrible. They expressed anger and, in fact, rage at the surgeon. When I examined the patient, there was perhaps a slight facial asymmetry. The teeth appeared normally aligned, and categorically the temporomandibular joint the patient insisted was dislocated was not. This is a delusional belief, a form of psychosis. So body dysmorphic disorder tends to begin in adolescence, and interestingly, it affects males and females about equally. Anorexia nervosa, which is also a type of body dysmorphia, is not included in body dysmorphic disorder. Patients tend to repetitively check their appearance throughout the day, and they may isolate or avoid social contact because they believe their appearance is so awful. There is a form of body dysmorphia which predominantly affects males, and it's called muscle dysmorphia, or the more common name, bigorexia. In this condition, males who exercise regularly to build up muscle become obsessed with the idea that they're losing muscle mass. I read of one such patient about a year ago who would ask his father, with whom he lived, over 100 times per day if the father thought that the patient's muscles were shrinking. I myself had a patient who was obviously very concerned about his appearance, a young man, very neatly groomed and well-dressed, who exercised by lifting weights regularly. He was involved in a minor automobile accident, had some muscle sprains and strains, which required him to cut down on his weightlifting for a couple of weeks. Every time I saw him, he'd be in a state of agitated panic over losing muscle mass, although I could detect no loss at all. Now, to make the diagnosis of body dysmorphic disorder, the defect which the patient is obsessed with has to be either minimal or trivial. A patient with a truly severe disfiguring defect who is upset about it would not be considered to have body dysmorphic disorder. Similarly, it's important to differentiate vanity from body dysmorphic disorder. The person who is vain tends to believe that their appearance is normal, but they'd like to enhance it. The person with body dysmorphic disorder believes that their appearance is awful or terrible or horrific, and would be happy to obtain a normal appearance. These patients tend to present to dermatologists and/or plastic surgeons, and may also pick at perceived defects in their skin. Interestingly, there's a hereditable component to body dysmorphic disorder, with it being about 0.4% hereditable. Many people think that the current obsession with social media is feeding the disorder. Social media such as Instagram or Snapchat presents numerous examples of suprahuman attractiveness and appearance. For example, many of the young men are using synthetic hormones to produce a musculature that would be impossible to obtain no matter how hard they exercised without hormones. Females often have enormous breasts or augmented buttocks, again, impossible to achieve through nature. There are many filters which can alter the patient's appearance to make them suprahumanly attractive. For example, there's a filter I've seen women use which enlarges their eyes to a size that cannot be achieved in natural humans. It makes sense that people who are already distressed by their appearance will feel even worse when they are constantly bombarded with images of people who are attractive beyond genetics and God's ability to create. There's a screening questionnaire which is very brief and simple called the Body Dysmorphic Disorder Questionnaire, which I'll link to in the description below. If you are a dermatologist or plastic surgeon and you encounter a patient you believe may have body dysmorphic disorder, it's imperative that you not perform procedures on them. As in all situations, surgery is not the treatment of choice for delusions, and body dysmorphic disorder is a delusional disorder. The patients are out of touch with reality. Procedures such as dermatological injections or plastic surgery rarely make the patient feel better. Either the patient is unhappy with the body part after the procedure, or after the procedure they may focus their attention on another body part. Even worse, the patient's disappointment and anger often is directed at the physician. They can be litigious, they can be threatening, they can be violent, they can even be murderous. Happily, there is help for some of these folks. They tend to respond well to serotonin reuptake inhibitors and also respond well to psychotherapy. So if one encounters a patient with body dysmorphic disorder, a referral to a therapist would be appropriate. Well, I hope you found this interesting, and as usual, always remember, if it happens, it's possible.